Hello and welcome to our special series, Medikabazaar presents Transforming Healthcare, wherein we showcase movers and shakers from within the healthcare fraternity who are changing the face of India's healthcare landscape across their respective specialties. In this episode, we'll do a deeper dive on how the diagnostics industry is attempting to bridge the gaps in the healthcare supply chain ecosystem, from our country's major metros down to its most rural corridors.
The diagnostic industry has emerged as an attractive player in India's growing healthcare sector and is one of the fastest growing services in the country, especially after the COVID-19 pandemic. The industry is divided into two categories, pathology and radiology. Pathology is related to testing of all major illnesses, whereas radiology is related to imaging diagnosis such as X-rays, CT scans and ultrasounds. Pathology accounts for 58% of the revenue in the diagnostic industry, while radiology accounts for 42%. Increased insurance penetration, aging population, rising income levels, preventive care and wellness, rise in chronic and lifestyle diseases, high evidence-based treatments, high unorganized services, coupled with the government's healthcare measures are the primary growth drivers for the industry. However, the industry is characterized by a high degree of fragmentation with over 100,000 labs. This fragmentation challenges the capabilities, scalability and quality of labs and testing. On the other hand, it also provides an opportunity to consolidate newer business models to evolve.
The India diagnostic industry and specifically IVD, one trait that really differentiates the India from the rest of the world is affordability, and it's not just very affordable. In fact, India IVD or the diagnostics is the most affordable in the world. The second fact that we should all be very proud of is the agility of the India industry. The last 2 years of COVID were very clear in making it visible that from April 2020 to April 2022, as against less than 300 labs, now we are more than 3,000 labs who do PCR testing. As against less than or up to 4 local manufacturers, now there are more than 40 active local manufacturers. So this agility and flexibility in healthcare is a strength to India. Even India IVD industry from a manufacturer standpoint is estimated to be over $1 billion USD, which is 2 to 4% of the global IVD industry, but is expected to grow at double the pace of the global industry. The growth for the industry, where is it, how is it going to be fueled? So one is the aging population. Over the next 5 years, it's estimated that people over 60 years, there will be as many as 50 million people in that bracket which will get added. That's like adding a South Korea full of aged people in 5 years. The last thing I'd say for the growth there is the lifestyle diseases. So when we talk of the rising burden of diabetes, obesity, that's definitely fueling the growth.
Let me tell you, this is the in vitro diagnostics industry which we are in. Sometimes we call it a medical. Is close to 15,000 crores and is growing. Now, there is 2 factors to the growth of this industry. One is the wellness market and one is the illness markets. Honestly speaking, there are another factor which is helping the growth of this industry is the unorganized sector. There is close to 100,000 labs in India, and whatever happening is today, lot of corporates like Tata, Lupin, Reliance, Adani, Intas, Mankind, they have started coming in this business, and what they are doing it, then converting unorganized market into the organized markets.
The diagnostic industry is one of the fastest expanding service verticals in India, which is classified into hospital-based, which accounts for 37% of the market share, standalone centers, which accounts for 47%, and diagnostic chains at 16%. Within healthcare, the diagnostic sector has played a very important role in the global response to the pandemic. According to Praxis Global Alliance, the industry is expected to grow at a CAGR of 14%, touching $20 billion by 2026 from $10 billion in 2021. However, the share of the urban market constitutes 65%, while rural is 35% in the growth of the industry. The Indian in vitro diagnostics or IVD industry has also truly been a trailblazer for all other industries to become self-reliant in the pandemic. According to Modor Intelligence, the market was estimated at $1.3 billion in 2020 and is expected to reach $2 billion in 2026, registering a CAGR of nearly 7.10%.
Post-independence, what has been seen is the market was dominated by the MNC companies. However, with the passing of time, the Indian companies built up the capabilities and started offering products at affordable prices to the end customer. The diagnostics is also becoming personalized due to genomic and genetic testing. Now, if I give some statistics, from the total size of the labs, 16% are the central labs, 37% are labs which are attached to the hospitals, and 47% are standalone labs. The Indian companies are silently transforming the industry in a sense that they are working on solutions which is called as the point of care solutions, wherein the testing is done near the patient. The other revolution which is happening in diagnostics is the telemedicine and mHealth, and these are actually putting the wearable medical device technology to a greater use for the purpose of monitoring. Now, the government also understands, and that's the reason why under the umbrella of the National Health Mission, they are actually reducing the gaps which were actually identified under the medical devices as well as in the in vitro diagnostics.
The Indian population is 18% of the world's total, but India's share of the global IVD market is just about 2%. The Indian IVD market has been growing at a CAGR of 15% against the average global growth rate of 5% over the past decade or so, and yet it has not been able to cross the 2% share mark. There clearly is a dichotomy, and one of the main reasons that appears to be is technology, and technology seems to have a direct relationship with market size. Diagnostics labs in tier 2, tier 3 cities tend to be smaller in size, with an average workload of 50 to 100 samples per day. As we know, there are two unique features of diagnostics tests. One, their relatively short shelf life ranging between 3 to 18 months, and secondly, the need for an unbroken cold chain during the process of transport and storage. These diagnostics labs in tier 2, tier 3 cities therefore face a challenge in making available esoteric and special tests. As a result of this, they have to outsource the testing of these parameters to bigger pathology labs. In the coming years, when the awareness, affordability and demand for diagnostics tests increases in tier 2 and tier 3 cities, these labs would possibly re-engineer and re-equip themselves to overcome such procurement related issues too. The future of the diagnostics industry lies in the development of faster, more sensitive, user-friendly and IT-capable devices.
Diagnostic tests are a very crucial element in healthcare system. In the pandemic, recently in the second wave, the diagnostic sector has proved a very important part of Indian healthcare system. Recent study of WHO, it indicates that this sector comprises only 5% of hospital cost, but its decision influence 70% of the healthcare systems. Indian diagnostic industry is in developing phase. The global medtech products are chemiluminescence, molecular platforms, drug of abuse, allergy testing. These are the recent requirement of diagnostic industry. But the major challenge of Indian diagnostic industry is we lack skilled talents in the country. We don't have a cold chain infrastructure in tier 2 and tier 3 cities. They are very unorganized lab in remote area of the country, and we don't have a awareness on preventing testing. These are the major challenge of the industry. The Indian IVD industry is estimated around 9,500 crore in 2021, and it expected to grow by 15% CAGR every year. But the challenge of Indian IVD industry is that we don't have high technology products. the 80% of industry is depend on Chinese players and other players from the world. But I am sure under the Atmanirbhar Bharat, we will start making this instrument within few years and will compete worldwide. Digital platform has become a very important part in the ecosystem of the country. This digital platform create awareness and availability of products in the country. Definitely, diagnostic company collaborating with digital platform will increase the reach and awareness of product to the customer, especially in Tier 2 and Tier 3 cities. This digital platform will give more choice of product from different companies in Tier 2 and Tier 3 cities.
On that note, it's time for a short break, but our special feature series, Medikabazaar presents Transforming Healthcare, continues on the other side. So stay tuned. Welcome back. You're watching our special series, Transforming Healthcare. We're in conversation with game changers from the diagnostic space who are sharing their take on both industry shortcomings as well as where the most promising solutions lie.
The diagnostic industry has emerged as an attractive player as the government has also recognized the importance of ensuring diagnostic services at all levels of healthcare. Sensing the needs of the present and the future, clinical labs are also amid a technological revolution that is focused on increased efficiency, improved quality, and reduction in errors in the delivery of healthcare services. This will further fuel the demand for experts to monitor and service robotic equipment, skilled biochemists, microbiologists, phlebotomists, biomedical engineers, and allied healthcare professionals.
So the on-demand marketplace for diagnostic companies like ours, this probably will be a very critical go-to-market tool in the times to come, because when we are talking of penetration into geographies in such a fragmented market, then portfolios like the POC, point of care devices, this can play a very critical role. Take an example recently of the rapid antigen tests, the RAT, and you can see how it was made available through these marketplaces. Tier 2, Tier 3 cities, see, for most of the players, they are banking on expansions in the Tier 2, Tier 3 cities in the coming 3 to 5 years as the major driver for their growth. So it becomes very, very important in that context. And we are talking of over 100 cities. Now, when it comes to procurement in these cities, I mean, typical challenges that one would, face in the IVD industry is the reagents and the consumables are temperature sensitive. They have limited expiry. Plus the awareness in these cities can also be a challenge. And with this kind of ecosystem, what comes to the forefront is a very strict discipline on the end-to-end inventory management.
If we look at the Indian diagnostics industry, it's pretty small compared to the worldwide market, so approximately 2%. But the interesting thing is that it is growing at twice the worldwide market. Today, during the COVID, there are two divergent trends. One is, what we have witnessed is consolidation, whereas like Dr. Lal and Metropolis, they have purchased small labs and they have expanded. So this we call as consolidation. Then you also have seen a lot of Tier 2 and Tier 3 cities where the testing was acquired and somehow the diagnostic industry has reached there and made it available. Companies like MyLab and Malbio has made the products available in the nook and corners of the country, especially the PCR testing at an affordable prices. So there are two divergent trends. And for the consolidation, what the labs require is a high-end platform, an integrated platform, where even the samples can be, the pre-analytics can be integrated. So the samples can be processed at a central location with a high throughput, and the cost can be, economies of scale can be leveraged. Whereas another thing which is happening is the decentralized locations, that patient needs the test immediately. So there is a very nice term called as point of care diagnostics, which has evolved, which means that you will get the diagnostics. It is not like moving the sample to the lab, which is consolidation. It is like moving the lab to the patient. So this is very important development, and a lot of technology platforms have evolved, innovative platforms have come in. We have been introduced to Medikabazaar by Mr. Chaitanya Sapkal, the head of the IVD division. And we have now partnered with them to reach the tier 2 and tier 3 cities to make our point of care product called as AFIAS so that the patients can do the test immediately and instantly on the point of care.
We heard from key leaders about issues, challenges and emerging trends across the industry. Now let's hear from Mr. Jitesh Mathur, Chief Revenue Officer at Medikabazaar, on how Medikabazaar is bringing a paradigm shift across the diagnostic space.
Medikabazaar has become India's #1 B2B online marketplace for medical equipment and supplies, and a single point of contact for all product-based needs, enabling medical institutions and individual practitioners alike to cut down on operational costs and making the best global brands available locally, all aided with the miracle that goes by the name of technology.
Diagnostics is the first part of healthcare, and the correct diagnostics actually can improve the healthcare access quite a bit for the patients. Diagnostic companies are looking at partners, especially Medikabazaar like partners, which are innovative procurement platform, to reach their customers or their patients or their buyers. And we serve what 20,000 pin codes across India. We have an extremely innovative digital interface which has AI built in, and we can really connect all the diagnostic companies to the diagnostic centers, the various buyers, the various hospitals which are everywhere in India, including in tier 2 and tier 3 cities, and that ultimately results in patients getting the access to these diagnostics tests. These could be basic imaging tests, high-end imaging tests, blood tests, urine tests, and all kinds of diagnostics which is required as a basic for many procedures which are in healthcare today. We are tying up with a lot of companies, and they are appreciating the effort that we are doing because we are able to connect the missing dots in the healthcare supply chain, and this includes digital interface for all these companies, and also managing inventory, reaching it finally to the last mile, which is the diagnostic centers or the patients which are there in villages, cities, large hospitals, small hospitals, and everywhere in India.
Medikabazaar's unique VPO, Value Procurement Optimizer, helps hospitals and the diagnostic industry to avail the unique benefit of one-stop procurement solution. VPO provides 360-degree optimization benefit where it takes care of the entire procurement process of healthcare facilities, such as availability of a complete range of supplies, on-time deliveries, assisted medical financing options, and regulatory assistance. Medical establishments are guided and aided at every step of the way towards a successful, streamlined, and transparent procurement.
India is geographically widely spread country, and our 65 to 70% of the population still resides in the rural area, and hence the healthcare demand is very high. Government initiatives like essential diagnostics test and Ayushman Bharat have again insisted that the healthcare demands has to be met in the rural area more than the urban. However, the supply chain management and the high cost of operations and supply chain is making it difficult for manufacturers to reach to the rural India. Understanding these challenges, Medikabazaar has taken a lot of initiatives to make sure that the supply chain challenges in rural India and 2 and 3 tier cities are met. We have built more than 35 CDCs and fulfillment centers in the country till date, and planning to do more than 50 fulfillment centers by the end of 2023, which will ensure the in-depth reach of these healthcare requirements or healthcare products to the rural population of the country. Not only that, Medikabazaar has introduced a great solution for the demand supply challenges. The solution is called as Vizi. Vizi is AI ML based software which helps in inventory management to all the manufacturers, to hospitals, to labs, to distributor. It does not only take into consideration your last year's consumption, but it also take into consideration seasonality, outbreaks, pandemic, and various other factors
to give you forecast of next 3 to 6 months of your test?
Spending about 15 years in industry and a good amount in diagnostics, I can say the industry is facing challenges in 3 areas. The first is the demand side, then the inventory, and the last is the supply portion. And Medikabazaar has got solution for all the 3 of those areas. First is the demand piece, and Medikabazaar has got some of the best AI-based solutions which help us for a better planning as a tool. The second piece is the inventory management. Most of the diagnostics products which you know come under temperature control and have a very short expiry from 30 days to kind of 1 year. Most of our fulfillment centers and distribution centers have the temperature control storage mechanisms where we can handle the temperature controls less than 20 degrees and 2 to 8 degrees and ensure that the distribution happens basis first expiry first out. The last piece is the supply. As you know, in the supply, the TAT and the SLA is extremely important. The reagents and the solutions for diagnostic needs to reach the customers within a very short period of time. Our drone, which we recently did a pilot testing, is a fantastic solution to reach out to some of the remote areas, the flood affected areas where the normal solutions can't come. Also our MBGO, the boys on the street, the whole fleet has got a app-based solution where they can decide their routing and the SLA on how the services can be provided.
Visi is Medikabazaar's proprietary and patented AI/ML-based smart inventory procurement tool for hospitals and other medical institutions. It provides medical establishments with the benefit of cost optimization, enhancing operational efficiency, and leap to smart decision-making processes. Visi aimed at preempting situations of excess inventory, avoiding stockouts that may result in neglected patient care, and preventing the expiry of medical products through structured, reliable, and accurate inventory planning, thereby reducing operational costs by up to 30%.
The biggest disruption to the healthcare market globally and India, of course, was COVID. India is very resilient to various seasonality and many diseases that we have seen in the past. But COVID disrupted everything, and Medikabazaar was able to provide a lot of backup to companies as well as to hospitals and diagnostic centers in these drastic situations where we had our own supply chain and managed inventory situations where we could supply the critical supplies and material to these hospitals. I think by using technology, we were able to really provide a lot of additional bandwidth to the whole diagnostic industry in India, and this includes our patented algorithms, which are Visi and which is an inventory management software, which is capable to providing hospitals and diagnostic centers to manage their inventory, predict and forecast the inventories. With the help of these tools, we were able to see what is the forecast which is coming, how much do we need to stock or how much do we need to import, and thereby we could fulfill some gaps in the diagnostic industry. Many disruptions will come, and diseases and seasonality will happen. But I think with the technology and procurement solutions such as online platforms such as Medikabazaar, we will be able to counter and stand up to these challenges with the inventory management softwares, our patented AI algorithms like Visi and our VPO solutions, and that's what we are trying to do by creating a full network of digital interface between the providers, which is diagnostic centers, hospitals, and all other services companies which are serving the patients, and the diagnostic companies which manufacture all these critical high-end equipment along with the consumables and supplies which are needed to run these tests. We are able to provide extensive product solutions to customers. When we started Medikabazaar, we had just a few thousand products online, and today we have more than 700,000 products. We serve about 20,000 pin codes, and every city which is in India, making sure that the critical consumables and supplies reach the diagnostic centers or small hospitals which are there in the villages and tier 2 and tier 3 towns.
Well, that's all we have on this last episode of our 3-part series, Medikabazaar Presents Transforming Healthcare. We trust you found the insights shared of value. Thanks so much for tuning in.